Hello, I am here with a very important topic which affects 5 to 10% of female population, that is polycystic ovarian disease or polycystic ovarian syndrome. When we call it a polycystic ovarian syndrome, it means it has more than one problem or more than one medical issue involved in it. If we take polycystic ovarian syndrome, we have the menstrual irregularities, we have the hair growth in the male distribution, the scalp hair may be very sparse or scanty, or maybe there may be hair loss. Along with that, there may be fertility issues, there may be difficulty in conceiving, plus there will be lifestyle diseases like especially like diabetes. So, the constellation of these various symptoms and medical problems is known as polycystic ovarian disease. The magnitude of the problem is it affects nearly 5 to 10% of the female population, and the population who usually they seek the medical help due to menstrual irregularities. There can be irregular periods, unpredictable periods, there can be over blood flow during the periods, under blood flow during the periods. All these issues are a part of polycystic ovarian syndrome. Another important after effect of polycystic ovarian syndrome is fertility issues or infertility. In many women, when they come for a checkup for infertility or when they have difficulty in conceiving, that is when polycystic ovarian syndrome comes into notice. There are certain cancers like uterine cancers which are seen more in women with polycystic ovarian disease, although the fertility issues and menstrual issues are more of a concern. Apart from that, the hair, thick black hair like the men have, in the distribution of over the face, over the mustache area, over the beard area, over the chest and abdomen is very distressing usually to young females who suffer from polycystic ovarian disease. And this is one major problem that they come for medical help. And many times it is a very difficult problem to handle, which requires medications plus cosmetic treatments. Another problem with polycystic ovarian disease is more propensity for lifestyle diseases. That this particular syndrome puts them at a higher risk of getting lifestyle diseases in future like diabetes, liver disease, hypertension, etc. Obesity is another major issue. Obesity is the cause and the effect for polycystic ovarian disease. In polycystic ovarian disease women, there is an insulin resistance, meaning whatever insulin is produced, it isn't acting well. There is some resistance at the cellular level. So, there is an hyperinsulinism or high secretion of insulin that happens to compensate this insulin resistance. This high insulin levels, it is a reason for obesity, especially the visceral adiposity, which is dysmetabolic or which is unhealthy. So, this obesity, as I said earlier, it can be a cause and an effect. This eventually makes them puts them at a higher risk for diabetes, hypertension, various lifestyle diseases. So, these are the various aspects of polycystic ovarian syndrome. So, what can we do by way of treating these women? One is, first and the foremost, is lifestyle modification. We can have a healthier lifestyle wherein we reduce, cut down on refined carbohydrates, we go higher on fruits and vegetables, giving them more fiber and proteins, or making them interested in some form of aerobic activity is also very important. So, as far as diet goes, the stress should be on reducing unhealthy refined carbohydrates and fats and substituting these with more of proteins and fibers. So, apart from that, we must have the girls, young girls interested in some form of physical activity which they can follow long term. Medically, what all can we offer? One is we'll have to give birth control pills or oral contraceptives to regularize the menstrual cycles. We have to give some certain drugs which may stimulate ovulation, a proper ovulation. The problem in polycystic ovary is there can be frequent ovulation, and these ovums may be mistaken as cysts, but the ovulation is not effective, thereby leading to infertility. So, there may be, you may have to help them with certain medications to, so that they get proper ovulation. Apart from that, there are the most important drug that we use is metformin. Metformin helps to an extent to curtail the weight, to reduce the insulin resistance, thereby reducing the insulin hyperinsulinism or high secretion of insulin. And there is a drug called spironolactone which can be used to curtail the male distribution of hair growth. So, even if you give these drugs, metformin and aldactone can to an extent help the male distribution of hair growth, but many times we have to resort to cosmetic treatments like laser therapy, etc., to help these girls with who get thick black hair, facial hair, which is very distressing. We should have regular sessions of counseling and motivational sessions, so that they are not depressed, because they are more prone for psychological disorders like depression and anxiety as well. So, these are certain areas where we can help the women with polycystic ovarian syndrome. But the first and the foremost and the point I want you to pay attention to is lifestyle modification. Always, whenever as the girls are growing, give them a healthy diet and teach them what is a healthy diet, make them interested in some form of physical activity, and all polycystic ovarian syndrome women may not have all components of the disease. A few may have 2 or 3 components, the other may have other components, but the major intervention one can do in their lives is modifying the lifestyle and giving them the necessary psychological support. There are certain studies which have brought to our attention the role of pollutants in polycystic ovarian syndrome. We know that this disease, which affects 5 to 10% of the population, is a modern day disease. Of course, the diet and lack of exercise plays a major role, but some pollutants like the plastics and hydrocarbons, etc., they also play a major role in the causation of polycystic ovarian syndrome. So, basically, let us keep ourselves healthy by having a healthy lifestyle, and at the same time let us be concerned about our environment as well, so that we can protect our young girls from this major distressing disease, which is, of course, which has remedies, but it is a lot distressing to people who suffer from it. Thank you.